Well, the COVID-19 pandemic was a time of great uncertainty and fear for everyone around the globe. When we are scared and when big changes happen very fast, it is natural for us to look for answers. The world felt like it was turned upside down, and the news seemed to change every single day. This confusion created a perfect environment for rumors and stories to grow and spread like wildfire. Some of these stories, often called conspiracy theories, sounded very exciting or deeply frightening. They traveled quickly from person to person, especially on social media platforms, promising simple explanations for a very complicated situation. These claims often tap into our deepest anxieties about control, safety, trust. It is easy to see why someone might believe a story that seems to explain everything in a neat package, especially when the real world feels so messy and unpredictable. Facts are our best tools for navigating through difficult times. They provide a steady guide when everything else feels unstable. This essay will look closely at 5 common conspiracy claims that became popular during the pandemic. For each claim, we will calmly and clearly present the facts that have been gathered by scientists, doctors, and researchers from all over the world. Claim the COVID-19 virus SARS-CoV-2 was not a natural occurrence. Instead, the claim says it was deliberately created in a laboratory by powerful people or governments. The purpose was to gain more control over the world's population to make money from the crisis to achieve some other hidden political goal. Fact: the overwhelming scientific evidence points to a natural origin. Virologists have analyzed the genetic code of SARS-CoV-2 in great detail. They found its structure is very similar to other coronaviruses in nature, especially those in bat populations. The virus shows features of natural evolution, not human engineering. For example, it binds to human cells effectively but with imperfections a human designer likely wouldn't introduce. Many independent research teams worldwide studied the genome. The global scientific community largely agrees the virus most likely jumped from an animal to a human. Diagram: bats, intermediate animal, humans. This zoonotic spillover is a common way new diseases emerge. We've seen it before with the original SARS and MERS. A global plot would need unprecedented secrecy among thousands of scientists, doctors, and government officials. The pandemic caused massive economic damage that doesn't support a motive of gaining wealth or control. Claim: a very popular and persistent rumor was that the COVID-19 vaccines contained tiny, hidden microchips. The supposed purpose was to track and control people who received the vaccine. The story often suggested a powerful, shadowy group led by tech billionaires or secret government agencies using the vaccination campaign as cover for massive surveillance. Fact: this claim is biologically and technologically impossible. Vaccine ingredients are publicly known and reviewed by regulatory agencies like the FDA. Ingredients include lipids, salts, and sugars, and the active ingredients such as mRNA. There are no electronics, no metals, no microchips in the formula. A microchip big enough to transmit would be far too large to pass through a vaccination needle. The rumor likely comes from misunderstanding packaging. Vials do have barcodes or QR codes on their labels. Those codes are for inventory management, like grocery barcodes. They help track the vaccine batch, expiration date, and destination. Codes are on the outside of the vial, not injected. We are already tracked by everyday tech. Smartphones, GPS in cars, credit card purchases, social media activity. A plan to inject microchips into billions would be wildly inefficient and unnecessary. The microchip claim is science fiction, not scientific reality. Section 4, Conspiracy 3, 5G towers are spreading the virus claim. As the pandemic began to spread, a strange theory emerged that linked the illness to the rollout of 5G mobile technology. The claim suggested that the radio waves emitted by 5G cell towers were causing the symptoms directly, or weakening people's immune systems. Some versions even proposed the virus could travel on 5G radio waves themselves. This idea spread rapidly online and led to vandalism against cell towers. Fact: this claim is based on a misunderstanding of biology and physics. Viruses and radio waves are completely different things. A virus is a biological agent, a tiny particle made of genetic material like RNA or DNA wrapped in a protein coat. It spreads by infecting living cells and copying itself. Radio waves are a form of electromagnetic radiation like light waves or microwaves. They power our cell phones and radios. A biological virus cannot be created or transmitted by radio waves. There is absolutely no scientific evidence connecting 5G technology to COVID-19. The virus spread widely in regions where 5G had not yet been installed. For example, Iran had no 5G network at the time and still had a major outbreak. Conversely, South Korea had one of the most advanced 5G networks, but managed its initial outbreaks more effectively than many countries with less 5G coverage. The illness is caused by person-to-person transmission of the SARS-CoV-2 virus, not by proximity to a cell tower. This was a coincidental timeline, not a scientific link. Section 5, Conspiracy 4, Masks are ineffective and harmful claim. Many said masks didn't slow COVID-19, some even claimed masks were harmful. Claim, masks trap carbon dioxide causing oxygen loss. Claim, masks weaken the immune system by blocking everyday germs. The story framed mask mandates as government overreach and control, that turned mask wearing into a political flashpoint. Fact, a large body of scientific evidence shows masks reduce transmission. How the virus spreads, respiratory droplets from coughs, sneezes, talking, breathing. A mask acts as a physical barrier, catching many of these droplets. This is important because people can spread the virus before they show symptoms. The primary benefit of wearing a mask is to protect others from your germs. The idea masks cause oxygen deprivation or CO2 buildup is not supported by science. Mask materials are porous. Tiny holes let gases pass while blocking droplets. Doctors, surgeons, and nurses have worn masks for hours a day for decades without oxygen issues. Masks are one layer in a multi-layered defense. Hand washing, good ventilation, keeping a safe distance. Think of it like a slice of Swiss cheese. Each slice has holes, but stacked together it's harder for anything to pass through. Masks are one important slice, helping keep the entire community safer during a pandemic. Section 6. Conspiracy 5. The death toll was inflated for money. Claim. This conspiracy theory alleged that the number of deaths attributed to COVID-19 was deliberately and falsely inflated. The story claimed that hospitals, doctors, were financially incentivized to list COVID-19 as the cause of death. The motive, according to the claim, was that hospitals received more money from governments, insurance companies for treating COVID-19 patients. This led to the belief that the pandemic was not as deadly as reported and that the crisis was exaggerated for financial gain. Fact. While payment systems can be complex, the idea of a coordinated plot by doctors to falsify death certificates is not realistic and is against medical ethics. Doctors, coroners follow strict, established guidelines when determining cause of death. A death certificate is a legal document that often lists multiple contributing factors. If a patient with a pre-existing condition like heart disease died as a direct result of a COVID-19 infection, the virus is correctly listed as the primary cause because it was the event that led to the death. In reality, the official death toll was likely an undercount, not an overcount. This is because testing was limited at the beginning, and many people who died at home or in nursing homes were not tested for the virus, even if symptoms matched COVID-19. Researchers often look at excess mortality. In nearly every country, excess deaths during the pandemic were significantly higher than the official COVID-19 death count, suggesting the true toll was even greater. The high death toll was a tragic reality witnessed by frontline healthcare workers worldwide. Section 7. Conclusion. Choosing clarity over chaos. The COVID-19 pandemic was not just a health crisis, it was also an information crisis. In the midst of fear and uncertainty, conspiracy theories offered seemingly simple answers. However, as we have seen, these claims, lab-made viruses, tracking microchips, 5G dangers, ineffective masks, inflated death tolls, facts provide a much more reliable foundation for our decisions. The scientific method, though sometimes slow and evolving, is a powerful process for finding the truth. When scientists from different countries, using different methods, all arrive at similar conclusions, that the virus is natural, that vaccines are safe and effective, that masks help reduce spread, the pandemic showed the incredible things people can accomplish when they work together. Scientists developed vaccines in record time. Healthcare workers showed breathtaking courage. By choosing clarity, trusting in evidence, and acting with care for one another, we can face any challenge. The path forward is lit not by scary rumors, but by the steady shared light of human knowledge and cooperation.